Hello there, and welcome to my video. Today we will discuss how to handle written medication orders. The information contained in this video was taken from the Providing Residential Services in Community Settings, a training guide curriculum, which is the approved curriculum for direct care staff in certified adult foster care facilities. This curriculum was a collaboration of multiple departments and individuals knowledgeable and experienced in areas outlined in the curriculum. The curriculum, as a foundational guide, continues to be applicable. Let's get started. In order for the physician to prescribe the best treatment and medication, the following types of information should be provided. 1. The person's complete medical record. 2. History of any allergies. 3. Current medication being administered, and for what purpose. 4. Medical and dental conditions. And 5. Written observations of recent physical and behavioral changes. The following information about each medication must be obtained before it is given. 1. Purpose of the medication and therapeutic effect. 2. When should the desired effects be expected to occur? 3. Are there any unwanted side effects? What actions should be taken if they occur? 4. Are there any known drug interactions with drugs the person is currently taking? 5. Are there special administration or storage instructions? Note, the above information and additional information may be obtained from the pharmacist, nurse consultant, or from a current drug book. If you have doubts, check them out. When the physician decides that a person requires treatment with a medication, the physician writes the prescription to be taken to the pharmacy. A copy of the prescription is necessary for each site where the medications will be given. A copy of the prescription from the most recent doctor's appointment, hospital discharge, and other appointments. Copies of the prescription must be kept on site to reference when passing medications. This applies to all prescription medication and over-the-counter medication. Telephone medication orders. Occasionally, in emergency situations, a physician may need to give an order for medication without seeing the person. Since only persons licensed to do so can receive telephone orders for medication, the procedure is as follows. 1. Ask the physician to call the medication order into the pharmacist. The pharmacist records the order, dispenses the medication, and then files the order for future reference. 2. Carefully document in the person's record time and date the emergency occurred, a detailed description of the emergency, and the name of physician contacted and any instructions given. 3. Obtain the medication from the pharmacy. 4. Ask the pharmacist for a copy of the prescription for the person's record. 5. After obtaining the medication from the pharmacy, document in the person's record all the information on the prescription pharmacy label. Remember, at times, a physician may forget you are unlicensed and proceed to give you a medication order over the phone or in person. You must remind him or her to call the order to the pharmacist. Holding or discontinuing medications. You may be instructed by a physician to discontinue or hold a medication. You may hold the medication and must contact your nurse. When you receive a telephone order from a physician that is not for medication, the procedure to follow is: 1. Repeat the order back to the physician for confirmation. 2. Be sure to understand what you are instructed to do. Ask any necessary questions to be sure. 3. Immediately write down the name of the doctor you talked to, date, time, order, what was said, and your signature. 4. Notify supervisor and nurse consultant. If you have questions about how to handle written orders or telephone medication orders, contact your supervisor, nurse consultant, or medication administrator.